So I treat primarily pancreas cancer. Patients often present to me with symptoms like jaundice or abdominal pain or weight loss. They oftentimes will come already with a diagnosis, but if they don't, we know what to do. We start with usually imaging, so that's often something like a CT scan or an MRI. We get biopsies. We do that a number of different ways, kind of depending where the tumor is, what is going to be the best for the patient. And once we have that diagnosis established, then we need to do what we call staging. So we need to understand how advanced a patient's cancer is so that we can really then talk about their treatment options. One of the things I love most about my job is the team that I work with. I work with a team of medical oncologists, a team of radiation oncologists, a team of gastroenterologists, radiologists, pathologists, who all really come together to make sure that we're doing the absolute right thing for each individual patient. And honestly, that's part of the job that I love the most. I can call these people anytime on my phone and say, hey, this is what I have, this is the challenge, I'm not sure what to do, or I am sure what to do and I need your help. And we really work as a team to make sure that we're providing the very best care for that patient. I like to run and do triathlons and stuff like that, and I often use the analogy with my patients that if I'm in a really long race, like if I think, oh my gosh, I just got off this bike and I still have to run 13 miles, that's overwhelming sometimes. And at any given point, I just break it down into the next digestible increment, so I don't have to run 13 miles, I just have to run to the next stop sign or whatever that is. And so I tell my patients the same thing, instead of sometimes looking at that whole big journey, how do we help them break it down, and how do we say this is what we have to deal with now, and take things one step at a time and be there for them when it gets overwhelming. I was diagnosed with cancer in June and had surgery in June, and I did the same thing that I'm telling you. I kind of break it down into bite-sized pieces and do what I can handle. It's given me a little more appreciation for what my patients are going through. So I'm probably one of the most educated, at least around what's going to happen in surgery, people that I know, and yet I know the complications, but when they happen to me, it's a totally different event. Like when you're the patient and you're living that and you feel terrible. And sometimes when my patients feel really terrible, I'm always like, it's going to get better. It's going to be okay. In a few months, you won't remember this. And when I felt really terrible, I was like, I'm never going to get better. And I know better. I know that's not true. But I just have a different appreciation. And maybe sometimes they don't need me to say, you're going to get better. Maybe they need me to just be there with them and be like, yeah, I know, it's terrible. And just kind of sitting by their side and understanding what they're going through, I just have a new appreciation for it.